I want to talk a little bit about our class that we have that helps to coach you through getting started. And so we this is a class that we've had in person for years and years and years and years, and we've modified it to be virtual. And so what virtual does is it helps you not have to physically get to a class, but it also is going to help to sort of unbatch the learning, so you're not overwhelmed by 2 3 days of learning. You're actually learning a little bit and going and applying, and learning a little bit and going and applying. And so in this class, we talk about all these different methods across the top, including leadership role and leadership behaviors, as well as what are some easy, quick things that we can do to start huddling, or with our medical assistant and provider, or some easy ways to standardize our exam rooms or make our environment a little more visual. And so lots of different things to try throughout the course, with coaching all along. And so we're your accountability partner. We're also your coach. And so if things aren't working, we can help talk you through and adjust as needed. Um, and so this is our how our course is designed. And so here's some examples of what people can create out of the course. And so one would be, standardizing their adult rooming sequence. Right? What does that look like? I love the number 5 on there, picking that default pharmacy right there up front, so you don't have to have the rework on the back end. Right? Or a standardized huddle. What are we addressing before the patients come in so that we can be ready for them? Or organizing a large supply closet, right? Are we color coding our supplies in ways that we can find those respiratory versus cardiac versus GI supplies? And that example around standardizing some of the setup for getting ready for procedures and things like that. So these are just some of the examples that you can practice throughout the course, as well as another example from one of the medical centers that we've worked with in California, that had a challenge again around staff turnover and patient satisfaction, and that they had referral backlog issues. And so they applied some of the techniques to get them into flow. And we jump started their training by training 45 individuals right away to just go off, try to find waste and reorganize some of their workspaces. And so that really engaged some of those frontline in order to have some buy-in from the staff right off the bat, and then training leaders to help to coordinate some of the activities as well, and embed even more activities. And one of the things that they were focused on is really around inventory, right? And so how do we reduce our inventory and or make sure things don't expire, and rotate that inventory and make sure we have the right amounts as well. And so that's just a great example of how our work affects many different of our clients.